Hi, my name is Daniel Guerra. I'm a nursing education student. I'm going to be performing a head to toe assessment today. So you could just confirm your name and date of birth for me. Perfect. So I'm going to start off by assessing the skin on inspection and palpation. No rashes, no redness, no lesions, no masses noted. Skin is cool and dry. Skin trigger is good. Skin color is normal. Now I'm going to inspect the head. Head is normal cephalic, atraumatic, and symmetrical. I'm going to now palpate the scalp as I inspect it. No rashes, no redness, no lesions noted. Hair distribution is even. Any tenderness? Okay. Now I'm going to move down to the eyes, assess the sclera and the conjunctiva for any redness, discoloration, lesions, or discharge, of which there are none. Now I'm going to just shine a light in your eyes. If you could just look at me. And pupils brown reactive to light and equal, about 3 millimeters in size. Now I'm going to assess for capillary reflexes, direct and consensual. I'm going to place my hand here and I'm just going to shine a light in your eyes. Pupil constricts, opposite pupil constricts, and again, pupil constricts, and opposite pupil constricts. So papillary reflexes intact, both direct and consensual. Now I would assess the internal structures of the eye with the ophthalmoscope. What I would do is I would dim the lights in the room. I would get down eye level to the patient, have them stare at a point behind me, and I would stand about 15 inches away from the patient with the ophthalmoscope at a 15-degree angle away from their line of sight. Assess first for red light reflex and move in, and then assess for the structures of the eye, including the optic disc, the retinal vasculature, and the macular fovea, which should all be present. Then I would assess for visual acuity using the Snellen chart. I would have the patient stand 20 feet away from the chart, cover one eye, and read from top to bottom until they can no longer see the characters clearly. And that would assess visual acuity and optic nerve 2. Now I'm going to assess for extraocular movements. I'm going to ask that you follow the pen with your eye. Extraocular movements intact. So cranial nerves 3, 4, and 6 intact. Now I'm going to assess for convergence. So I'm going to, an accommodation, I'm going to ask that you stare at the wall behind me, and when I tell you to look at the pen, look at the pen. Pupils are dilated when staring at the wall behind me, look at the pen, and eyes converge and pupils constrict. Now I'm going to assess for visual fields by confrontation, so I'm going to ask that you conclude one eye and tell me how many fingers I'm holding up.
1.
And again on the other side.
2. 1.
So visual fields intact. Now I'm going to move laterally to the ears. I would assess the ears with the otoscope. Using the otoscope, I would pull the auricle up and back because the patient is an adult. And I would look into the ear canal first, assessing for any redness, discoloration, swelling, which there should be none. Then I would look further into the tympanic membrane. It should be gray pink in color. The light should reflect back off of it, and there should be no effusions present, and no swelling, redness, or discoloration on the tympanic membrane. Now I'm going to perform the whisper test, so I'm going to stand behind you. If you can cover one ear, and I'm going to whisper some things into your ear. ABC.
ABC.
And now the other ear, do the same.
1, 2, 3.
So patient was able to correctly identify, so cranial nerve 8 is intact. I would also assess for hearing conduction using a tuning fork. I would strike the tuning fork against my hand, place the base of the tuning fork in the midline of the patient's skull, and the patient should be able to hear the vibrations in both ears. Now I'm going to move midline to the patient's nose. I'm going to inspect and palpate. So septum is midline, no deviation noted, no drainage, swelling, discoloration noted in the external layers. I'm going to assess for patency of the nostrils. I'm going to include one nostril, and if you just breathe in and out. And the other nostril. So nostrils are painting bilaterally. I'm now going to ask that you close your eyes, and I'm going to close one nostril and introduce the smell. You can tell me what it is. And if you could do the same thing on the other side.
Coffee.
Perfect. Patient was able to identify both smells, so cranial nerve 1 is intact. Now I'm going to assess the sinuses, both frontal and maxillary, for any tenderness. Frontal first. Any tenderness?
No.
Any tenderness?
No.
So both frontal and maxillary sinus now tender. I'm going to move down to the mouth. Lips are pink and moist. No cracking or ulcerations noted. I'm going to ask you to open up the mouth. So oral mucosa is pink and moist. Dentition is good. No missing, loose, misshapen teeth. Gums are no swelling, no bleeding, no discoloration noted. And soft and hard palate are pink and moist. I'm going to ask you to touch the roof of your mouth with the tip of your tongue. And the floor of the mouth is pink and moist. Again, no swelling, discoloration noted. And now if you could say ah for me real wide. And the oral pharynx is clear. Tongue and uvula rise in the midline. No tonsillar swelling or tonsillar exudates noted. Now, if you could just stick out your tongue for me and move it from side to side. And now press your tongue up against my hand from the inside of your cheek. And again on the other side. Perfect. With that, cranial nerve 12 is intact. I'm now going to, if you could repeat back to me, light, bright, dynamite. So patient's voice is, quality of voice is clear, no breathiness, hoarseness, nasal quality noted. So cranial nerve 9 and 10 are intact. Now I'm going to ask you to clench your teeth real tight. Perfect. And I'm going to ask you to close your eyes. I'm going to introduce some sensations to your face. Just tell me if it's soft or sharp.
Soft. Soft.
And again.
Sharp.
Okay. Patient was able to correctly identify the sensations. So, and with that, and I would assess for now the blink reflex. What I would do is I would ask the patient to close one eye, and I would, with a fine wisp of cotton, just kind of attempt to brush against the cornea, and the patient should blink, and the patient should blink in both eyes when assessed. And with that, cranial nerve 5 would be assessed and intact. And now I'm going to ask that you just puff out your cheeks for me, raise your eyebrows, smile, frown. That I've now assessed that cranial nerve 7 is intact. Now I'm going to move on to assess the lymph nodes for any tenderness. They should be soft and smooth, starting with the preauricular, postauricular, occipital, posterior cervical chain, tonsillar, submandibular, submental, superficial cervical chain, and the supraclavicular. Any tenderness? Okay, perfect. Now I'm going to inspect the midline and inspect the trachea and its midline, and I'm going to palpate. No masses noted, no deviation. I'm going to go around and assess the thyroid. I'm just going to ask that you swallow. And one more time. So thyroid isthmus is midline. Now I'm going to ask that you press up against my hands with your shoulders, and now press your face up against my hand, and again. So cranial nerve 11 is intact. Now, if you could just turn around for me, I'm going to assess the posterior thorax, and no rashes, no redness, no masses, no lesions noted, no retractions. Respiratory rate is even and normal. I'm going to assess for respiratory expansion by placing my hands here and just take a deep breath. Respiratory expansion is symmetrical. I'm going to assess tactile fremitus by placing my hands here, and when you feel them, say 99.
99.
Perfect. Fremitus is equal bilaterally. I'm going to progress along the fields, and all along fields are resonant, no dullness noted. I'm going to now auscultate the lung fields. So you could just breathe in and out for me when you feel the stethoscope. So the lung sounds are clear bilaterally, no rales, no rhonchi, no wheezing, no adventition sounds heard. And now I'm going to assess for cacophony, so when you feel my stethoscope, just say E.
E, 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 E.
So clear E sound heard, no A sound. Now I'm going to ask you to turn around for me, and I'm going to assess the anterior thorax, which is again, no rashes, no redness, no lesions, no masses noted. Now I'm going to listen to the heart sounds. So I'm going to start at the right sternal border at the second intercostal space to assess for the aortic valve. Second intercostal space left sternal border to assess for the pulmonic valve. Fourth intercostal space left sternal border for the tricuspid valve. And fifth intercostal space left midclavicular line for the mitral valve. They're all present. And now I'm going to ask you to turn over to your left, and with the bell of my stethoscope, I'm going to listen for S3 at the fifth intercostal space at the left midclavicular line, and S3 is present. And now I'm going to come around and assess the carotids. No abnormal pulsations noted. Now I'm going to palpate them one by one. And pulses +2 bilaterally. And I'm going to listen for any bruits with the bell of my stethoscope and just take a deep breath in when I place the stethoscope. No bruits noted. Now I'm going to assess 4 pulses throughout the body, starting with the brachial, the radial, and the popliteal behind the knee. And all pulses +2 bilaterally throughout. I'm going to ask that you lift up your leg, your pant leg, so I can assess the lower extremities. No cyanosis noted, no paleness noted, no edema noted. Okay, now I'm going to perform the abdominal assessment of the exam. If you could lay back for me, I'm going to inspect the abdomen. No pulsatile masses noted, no bruises, no discoloration, no rashes, no redness, no lesions. I'm going to auscultate the 4 abdominal quadrants, the diaphragm, starting from the right lower quadrant. So all 4 quadrants are normal and active bowel sounds. Now I'm going to assess the major arteries in the abdomen with the bell of my stethoscope for any buoys, starting with the aorta, the right renal artery, the left renal artery, the left iliac artery, the right iliac artery. No bruits present in any of them. Now I'm going to percuss the abdomen. And percussion is tympanic, no dullness noted. Now I'm going to percuss to assess for liver span. I'm going to start right midclavicular line below the breast line and percuss down. So I'll mark where the dullness is heard, and again, right midclavicular line starting from the right lower quadrant going up. Mark where the dullness is heard, and it's about 6 millimeters in length, which is normal. So now I'm going to palpate the abdomen, starting with light palpation. Let me know if there's any tenderness. Any tenderness? Okay, now I'm going to start with deeper palpation, starting in the right lower quadrant. Let me know if there's any tenderness when I push down or let go. So no rebound tenderness, and I'm going to assess the right upper quadrant. Let me know if there's any tenderness. Take a deep breath and let me know if there's any tenderness. Okay, no negative Murphy sign. Now the left upper quadrant and the left lower quadrant. No tenderness. Perfect. Now I'm going to assess for the size of the kidneys. I'm going to reach around back, and then I'm going to ask you to take a deep breath in and let it go and hold to birth. Perfect. And again on the other side, take a deep breath in as I palpate, and then let it loose and hold it. So non-enlargement of the kidney noted. I'm going to assess for CVA tenderness by striking my hand at the costovertebral angle. Let me know if there's any pain. And again, let me know if there's any pain. Perfect. So that's my head to toe assessment.